Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update for January 12th, 2023. This week, we're going to continue the same series we began last week, which is what are the best steps we can take to live as healthy a life as possible? How do we separate fact from fiction? Well, this week, I'm going to do what I did last week, which is start with a very obvious issue, and that is, what are the health implications of being overweight or obese? Now, by definition, overweight is a body mass index of between 25 and 29. Obese is a body mass index over 30. And a body mass index, BMI, is a measure of body fat based on height and weight. There are formulas you can look up if you want to just pause this screen here. For example, if you're 67, 5'7", and you weigh 198 pounds, then your BMI is 31 and you're considered to be obese. So take a moment, you can calculate your BMI here. Now, if you look at obesity rates around the world, they vary quite a bit. These are the most obese countries in the world, at least in the most recent report. Most of them are Pacific Island nations, and many are Middle Eastern nations. The one outlier in all of that is the United States, with a rate of 36.2%. And you can see the world's distribution of obesity is not evenly distributed. Now, we often think that obesity has been an issue, been a public health issue for a long time. In fact, the first Surgeon General's call to action on obesity, overweight and obesity didn't come out until about 20 years ago. And the reason for that is we have seen a tremendous uptick in the rates of obesity. This is body mass index over 30. You can see in 1990, there was only one state with more than 15% of its adults who were obese. 5 years later, it's across much of the central part of the US. 5 years later, there's only 2 states that are less than 15%. 5 years later, you can see 5 states below 20% and many above 25%. By 2010, you can see there's only 1 state left below 20%. By 2015, we're starting to see folks that are states that are 35% or more. And by 2018, it's spreading widely, and only 1 state below 25%. So, 2 states, I apologize, Colorado and Hawaii. So if you watch that again, you see this tremendous growth in obesity in the United States. And here, if you want to stop and look where your state is, you can look here for obesity. And here, if you combine overweight and obesity, you can see that almost all states are 50% or more of its adults are either overweight or obese. Well, why does this matter? It matters because people that are overweight and obese are at increased risk of all-cause death, high blood pressure, coronary heart disease, stroke, type 2 diabetes, and so on. And a recent report looked at obesity over a 24-year period. And this is called a Kaplan-Meier curve. And what this says is, at the very beginning, time zero there at the bottom, 100%, one out of 1, people are still alive. And then over time, you can see a decreasing number. So the lower line is less healthy because a lower percent of people are surviving, right? And so what this is obese 1 is the light blue line, obese 2 is the dark blue line. And what you can see at about 27 years, 10,000 days, about 20% of the obese 2 people are alive, almost twice that number for those that are not obese. And if you look at this just for non-smokers, you can see that the rate is even greater. So there's a tremendous public health risk to being overweight or obese. The American Medical Association has given guidance to physicians to treat obesity as a disease, but not a shaming thing. It's not a behavioral choice. They discourage using BMI, but in fact, it tends to get used anyway. And the important recommendation is to encourage healthy habits for life. The American Gastroenterological Society advises physicians that the important part here is to consider long-term pharmacological therapy. So according to the CDC, the three things you need to maintain healthy weight are healthy eating, physical activity, and optimal sleep. And according to the National Heart, Lung, and Blood Institute, they agree: eat heart-healthy foods, get a regular physical activity, and get enough good quality sleep. In terms of food, be careful about fad diets. Do talk to your healthcare provider before you start any unusual or extreme diet. NHLBI recommends the DASH diet, the dietary approach to systemic hypertension, I think it is. But I would add a couple of things to this. I think it's really important, if you are overweight or obese, to talk to your healthcare provider about a referral to a nutritionist, which is obvious. Use of medications. This is something that's relatively new, but there are some medications that can be very helpful to folks who are having health issues associated with their overweight and obesity. This is not the right video to go into those, except to say that it's not for everyone, but it is available, and you should talk to your healthcare provider about it. And then bariatric surgery is something that used to be fairly uncommon. It's now being increasingly recommended. But again, talk to a healthcare provider, of course, before you go forward with that. The one other thing I would add is we need to stop the intergenerational cycles of obesity. We know that children with two obese parents are 10 to 12 times more likely to be obese. Weight gain in early childhood is significantly greater with obese parents. And heavier parents have been, children of heavier parents have been found to have less physical activity, greater preference for high-fat foods, lower preference for healthy foods. Now, whether this is genetic or behavioral or environmental doesn't matter. If we want to be a healthy nation, we've got to stop the intergenerational cycle and help our kids achieve a healthy weight. So what are the best steps we can take to live as healthy a life as possible? This second week, we're going to say achieve and maintain a healthy weight and appropriately active lifestyle. Seek professional help if you cannot achieve this on your own. So the 2 weeks we've said, don't start any nicotine products. And if you're currently using one, quit. And achieve and maintain a healthy weight. So these are easy. These are things everybody knows, but I didn't want to start a series on how we can live a healthy life without getting a couple of these obvious things out of the way. Please feel free, as always, to share these videos with anyone else who might be interested. If anyone would like to be added to the mailing list, please let me know or let Jan Stork know. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And please let me know if you have any questions or comments on this issue or any other evolving public health issue. As I've mentioned before, I will from time to time get back to updating COVID and other infectious diseases, but I thought that since things are relatively slow right now, this would be a good time to talk about how we can all live healthier lives. Until next week, please be well.